This is a pivotal moment for Ohio State University's health system as it unveils the name of its next-generation $2 billion hospital tower at Wexner Medical Center. The towering 26-story structure, designed to accommodate 820 beds, will officially become University Hospital when it opens in early 2026. According to an internal memo obtained by the Dispatch, the new building will physically connect to the existing Janes Cancer Hospital and Solove Research Institute, while also replacing outdated facilities and expanding care options. Its top 3 floors will specialize in women's healthcare, labor and delivery, and neonatal intensive care, with a partnership with Nationwide Children's Hospital to provide 51 neonatal beds. The memo emphasized that the name University Hospital has long symbolized the care delivered in Rhodes and Doan halls, representing the community's recognition of the institution's brand. This decision marks a dramatic expansion of services, as the tower will also elevate the brain and spine hospital's role. However, the naming process is not yet complete. Name changes, including the tower's designation, will take effect on February 22, 2026. Key adjustments include renaming Rhodes Hall to University Hospital Rhodes Hall, Doan Hall to University Hospital Doan Hall, and the Brain and Spine Hospital to University Hospital Pavilion. Roads and streets will also be rebranded, such as transforming Medical Center Drive West into East Park Street, where it intersects with West Park Street. The memo noted that all building addresses will remain unchanged. While the university declined further commentary, business reporter Samantha Hendrickson can be reached at shhendrickson@dispatch.com. But here's where it gets controversial. The choice to rename the hospital University Hospital itself raises questions about whether the new tower's identity aligns with the institution's broader mission. And this is the part most people miss. While the name change is official, the true transformation of the facility's role in healthcare delivery remains a subject of debate.